Hello everyone! Welcome to the cross-cultural healthcare learning classes. Today, we're going to learn about current healthcare issues in Malaysia. The main topics for today's lesson are vaccination, disease control for vector species, and traditional medicine for disease control. Part 1. Vaccination. In this era, outbreaks of diseases are more serious than any war could do. They all come in a sudden manner, and humans get nowhere to hide and have no idea how it started. How many scientists and medical staff were being sacrificed in Jumlah? We can't stop virus from occurring in the future, but we can protect ourselves from vaccine-preventable diseases. In this, vaccines become compulsory for every newborn baby. Vaccines are provided for free by the government and available for all Malaysian children. The National Immunization Program provides routine childhood immunizations for various infectious diseases nationwide. Generally, the degree of risk of major infectious diseases in Malaysia is intermediate. Food or waterborne diseases mainly cause bacterial diarrhea, and the most common vector-borne disease is dengue fever. As for water contact diseases, the latest one was leptospirosis in 2016 due to heavy rainfall which caused flooding in some states. The table shows the summary of vaccines which infants and children will receive from birth to the age of 13. The most important injections are tuberculosis vaccine, hepatitis B vaccine, and polio vaccine. Some vaccines are only given according to the state of disease spreading, for example, measles vaccine for Sabahan and Japanese encephalitis for Sarawak kids. Apart from that, some injections are considered compulsory for girls, for example, rubella and human papillomavirus vaccines. After having an introduction regarding vaccines, now let's proceed to Part 2, disease control for vector species. As Malaysia is located at the equator and is blessed with large tropical rainforest, mosquitoes are seemingly a common vector for spreading diseases as the weather is just optimal for breeding. The most common diseases are dengue, malaria, filariasis, and Japanese encephalitis. Now, let's have a closer look into each of the 4 diseases. Number 1. Dengue. Dengue fever is a painful, debilitating mosquito-borne disease caused by any one of 4 closely related dengue viruses. Symptoms, which usually begin 4 to 6 days after infection and last up 4 to 10 days, may include sudden high fever, severe headaches, pain behind the eyes, severe joint and muscle pain, fatigue, nausea, vomiting, skin rash which appears 2 to 5 days after the onset of fever, and mild bleeding, such as nosebleed, bleeding gums, or easy bruising. Treatment for dengue fever. There is no specific medicine to treat dengue infection. If you think you may have dengue fever, you should use sparing leverage with acetaminophen and avoid medicines with aspirin, which could worsen bleeding. You should also rest, drink plenty of water, and seek help from doctors. Preventing dengue fever. Vaccines for dengue are still in research and clinical trial stage, and therefore, currently, there is no vaccine available. The best way to prevent the disease is to prevent bites by infected mosquitoes, particularly if you are living in or traveling to a tropical area. Number 2. Malaria. Malaria is a life-threatening disease. It's typically transmitted through the bite of an infected Anopheles mosquito. Infected mosquitoes carry the Plasmodium parasite. When this mosquito bites you, the parasite is released into your bloodstream. Common symptoms of malaria include shaking chills that can range from moderate to severe, high fever, profuse sweating, headache, nausea, vomiting, diarrhea, anemia, muscle pain, convulsions, coma, and blood stools. The only malaria vaccine approved for use outside trials as of 2015 is RTS-ACE. It requires 4 injections and has a relatively low efficacy. Number 3. Filariasis. Filariasis, also known as lymphatic filariasis, is most common in tropical countries and is caused by parasitic nematode worms that look like tiny threads. Lymphatic filariasis starts from the bite of an infected mosquito or when a person comes in contact with water where infected mosquitoes breed. The parasitic worms that are transferred to humans burrow into the lymphatic system, a major part of our body's immune system. People who are affected by filariasis are subjected to social stigma and are unable to live a normal life. Filariasis is not a life-threatening infection, but it can cause lasting damage to the lymphatic system. The disease causes no symptoms in the initial stage. Therefore, most people initially are not aware that they have filariasis. But in the later stage, the symptoms may include fever, pain, skin exfoliation, and lymphedema with thickening of the skin and underlying tissues such as lymph or genital swelling, and in its worst case, elephantiasis. The drugs used in the MDA programs are ivermectin for onchocerciasis, albendazole for lymphatic filariasis, and albendazole plus either ivermectin in areas where onchocerciasis is also endemic or diethylcarbamazine in areas where onchocerciasis is not co-endemic. Number 4. Japanese encephalitis. Japanese encephalitis is a type of viral infection of the brain which spreads through a mosquito bite. It does not spread from one person to another. Less than 1% of people infected with Japanese encephalitis virus develop clinical illness. In persons who develop symptoms, the incubation period is typically 5 to 15 days. Initial symptoms often include fever, headache, and vomiting. Neurological damage, muscle weakness, and movement disorders may develop over the next few days. Seizures are common, especially among children. Japanese encephalitis is a vaccine-preventable disease. Thus, the best way to prevent Japanese encephalitis is to be vaccinated. Up to now, do you have a better understanding regarding 4 diseases? If yes, let us proceed to our last section. Finally, it comes to the last step. In previous lesson, we've learned about traditional medicine and some of today's current healthcare issues. Now, let's see what will happen when we apply traditional medicine to disease control. In Malaysia, dengue fever is considered as a common disease. Years ago, when westernized medicine practices were not yet introduced to the country, the emergency precaution for illness relieving was through intake of papaya leaf juice. The process is really easy. The ingredients you need are just 2 pieces of raw papaya leaves. After preparation of raw materials, follow the steps to get your secret recipe. First of all, take away the stems and the fibrous portions of the leaves. Squeeze out the juice and you may consume it directly. Repeat it for another 2 times in the day to feel the improvement. Legend without evidence is just a story, but tradition with proofs are knowledge. Now, let us have a peep at the case studies of Carica papaya leaves extract in the cure of dengue fever. This study was conducted in 1 patient. From the data, we could see that administration of Carica papaya extract did increase the platelets count, red blood cell counts, and etc. In Table 1, all digits are decreasing, but in Table 2, with the intake of papaya leaf juice, they're rising. Therefore, Carica papaya leaf extract did help cure dengue. This experiment was conducted in 300 patients. From the conclusion, we could say that Carica papaya leaf extract does significantly increase platelet count in patients. Carica papaya leaf extract do cure, but it's too bitter. Then what about capsule? Does it cure? Well, once more, there's a clinical case study conducted in a number of patients, and the results are great. Yes, it does cure dengue. Up to here, we could see that sometimes traditional medicines do have their effectiveness. But what New Era should do is to find out the theory within it so that the knowledge could be continued. Questions. Number 1. What are the 4 major infectious diseases in Malaysia? Number 2. Of the 4 major infectious diseases in Malaysia, which are vaccines not available for? Number 3. How is malaria transmitted? Number 4. What is Malaysia's natural cure for dengue fever? Now, do you know what to do if someone gets dengue? Share this out to let more people know it, and I hope you like this topic. Thank you. All facts and pictures were found on Google. None of this belongs to us. All rights belong to the creators and authors that are included in this video. This video is used only for educational purposes. No harm need to be done.